In the 2026-2027 national budget, the health sector that is under the Human Capital Development was allocated Uganda shillings 5.23 trillion, down from 5.87 trillion allocated in the previous year. One of the health priorities for government in the 2026-2027 national budget is improving specialized services, and shillings 4.5 billion was directed towards the purchase of specialized medicines. The Executive Director, Mulago National Referral Hospital, Dr. Rosemary Byanyima, says the additional 4.5 billion Uganda shillings now brings the budget for specialized medicines to 29 billion Uganda shillings.
But that notwithstanding, yes, we are grateful, but our budgetary requirement is slightly over 100 billion. So whereas we shall try and improve on what we are doing, we may remain constrained.
Other aspects that need critical attention in order to improve specialized treatment in the country include training of super specialized human resource, investing in the purchase of equipment, and better pay for the specialists.
Now, first and foremost, we need to put in place the necessary infrastructure, and that takes some time, but also to train the necessary health workers. That even takes more time. To train a cardiologist confidently may take him up to 15 years. If you look at the 5 years of medical school, there is a 1 year internship, then you work a bit, then you go and do M-Med for 3 years, then now you go and do another 3 years to become a cardiac surgeon, or you go and do fellowships and so forth. That would take anywhere between 13 and 15 years. So, but on the side of government, we started this journey about 10 years ago. And I'm confident to say that we now have the necessary skill set. But having the necessary skill set is one thing. Remunerating them, paying them adequately. Money that is commensurate to, one, to the years they have studied, two, to also that super specialized value, that skill that they are bringing. Like you very well put it, some of these surgeries in Turkey, India, the US, Canada, South Africa, may be anywhere between $30,000, $50,000. So, meaning that that person who performs that super specialized surgery on you, we have to pay him well. Because we may train him here, and then a hospital in South Africa gives him a better offer. I'm glad to say, under the guidance of His Excellency, the President, over the last 10 years, he's really been a champion of investing in scientists, meaning training them, but also remunerating them.
So we are grateful the government acquired an ADB loan which remodeled and re-equipped Mulago to be able to offer specialized services. But these equipments are now coming to almost 10 years, so they are becoming costly to maintain. It's high time that in the next 2 years we plan on replacing them. Otherwise, the technology becomes obsolete, and even maintenance and downtime affects our throughput.
Whereby government sets up these specialized facilities. And by the way, for your information, we have got very good experts in the country. Some of our doctors are the ones who go to Aga Khan in Kenya, others are the ones who go to India. So we have doctors. So what we need is the equipment. And we could manage it in a way that first we have got investors coming in to do this, and then over time, we gradually take over as a country. And Ugandans would definitely pay, but it would be cheaper than someone going to India or Turkey, and then you have to go 3 people, and then you have to pay an air ticket, and then you have got to pay hotel accommodation, and then you have to, so it becomes more costly. So those countries actually promote it as medical tourism, and they're making a lot of money, so that huge leakage can easily be controlled if we can strategically plan so that we have got these services back home, and the expertise we don't have, we can outsource it so that these people can do everything here.
Nevertheless, strides have been made.
Yes, we used to refer all orthopedic and maybe spine and neuro cases abroad, but we are able to handle quite a number. We continue to advance in our services so that we can continuously reduce on the referrals. Renal transplant is one of the programs which we are scaling up in terms of the number of patients we should handle. But there are also those which are more complex, and if you are starting a program, you cannot handle the more complex transplants. So we are taking it on slowly but surely, and we want to introduce liver transplant. We've already sent 2 teams to India for training, and hopefully we shall start.
Specialized treatment is a priority in this year's national budget to reduce expensive medical referrals, reduce reliance on foreign care, and boost universal health coverage. Adia Nakuchi, UBC.